charged with representing the interests of patients and employees during the bankruptcy proceedings, as well as helping employees get the wages they deserve and have earned. We're also working on 2 long-term questions. Those long-term questions are twofold. The first is, how do we ensure accountability? I know the public is eager to get answers on this, and I can't at this moment talk about that work until it's complete. And when it is, you will hear from us in a timely manner and with a sense of urgency. I also want to make it crystal clear that I take it very seriously any effort for this hospital system to make a profit to the detriment of patients, to strip mine hospitals for their value. And if those efforts have violated the law, those involved will absolutely hear from our office. And at the appropriate time, we will share that, and we will share with you, of course, in terms of that process. The second question that needs attention is, how do we ensure this never happens again? That work has actually already started. And it's been a long-term conversation, even before I got into office, with the legislature and the administration, that the Attorney General's office is right in the middle of. We're working with the legislature, proposing long-term policy solutions. We're pushing for tools that could be expanded to give the Commonwealth greater power while these things are happening and not after the fact. So that, for example, we don't again have the type of sale leasebacks that allowed Steward and its private equity investors to cash out in the short term while saddling their hospitals with long-term debt. That also, for example, means that we understand private equity investments when they are made and novel high-risk lending arrangements before they are entered into. I commend the House for addressing these issues in their recent bill, and of course will continue to work with the Senate on their proposal. I also want to thank the various local officials who represent areas where these facilities are, that are working tirelessly to respond to the needs and concerns of their constituents. Our immediate priority continues to be protecting access to care and jobs and working in partnership with them as well. We remain committed to evaluating the role of for-profit actors in the state's healthcare industry in the future, and this work is ongoing. And we will do this with the urgency and transparency residents across the Commonwealth absolutely deserve. It's an honor and privilege to stand here with these group of folks. Not everyone is going to speak today, as we all grapple with an unprecedented time in many ways. But I, along with my team, and I'm grateful to my team, will do everything in our power to hold anyone accountable for any type of wrongdoing while working with every agency up here to ensure access to care and to protect our patients and our employees. This time I'd love to turn it over to Julie from the Nurses Association. I think it's Julie. No, it's you. You're up. It's you, just for the work you do. Thank you, everyone.
Hello, everyone. I apologize in advance if I get titles inappropriate, but thank you, Governor Healey, Attorney General Campbell.
Thank you.
And I'm getting to know Kate Walsh very well, and Robbie Goldstein, and Secretary Jones. So I'll be brief. Certainly this is not the start of Nurses Week that I would have envisioned. So here we go. As an organization that represents nurses and healthcare professionals working in 8 of the Steward hospitals and 70% of all the state's acute care facilities, the potential loss of any of these facilities would have devastating consequences for hundreds of thousands of residents from the South Shore to southern New Hampshire. We need only to look at what has happened in southeastern Massachusetts with the loss of Norwood Hospital and then Brockton Hospital, where the influx of patients has stressed the region's already overburdened emergency departments, to see what lies in store if we were to lose any other facilities. We look forward to working with the administration, the legislature, the healthcare industry, and all those who value the health of our communities to use this process to take whatever steps are needed to ensure the preservation of these facilities and the safe transition to more stable, not-for-profit ownership. Inaction would worsen the healthcare inequities and weaken the entire healthcare infrastructure for all the patients of Massachusetts. Most importantly, we commend the dedicated and compassionate caregivers, healthcare workers, nurses, and physicians who throughout this incredibly difficult and stressful process have stayed the course. They will continue to provide desperately needed care. As this process unfolds, the voices of the patients, the workforce, and the community must be heard, and they must have a seat at the table as decisions about the future of healthcare in these communities are made. We remain hopeful, and we look forward to transitioning these hospitals to new ownership. Thank you.
Thank you. Thank you. Good morning still, everyone. Hope everyone is doing well on this Monday morning. My name is Tim Foley. I'm the Executive Vice President of 1199 SCIU. We represent over 85,000 healthcare, home care, and nursing home workers throughout the Commonwealth of Massachusetts. And we represent, and on behalf of the nearly 5,000 healthcare workers of 1199 who work at all of the Steward Health Care facilities, I want to thank our leaders gathered here today, particularly to the Governor, the Attorney General, the Secretary, and the Commissioner for all your support, your hard work, and thoughtful preparation for this day, and your support for the 1199 caregivers. Also, as well as for your commitment to the patients, the caregivers, and the communities these hospitals serve, critically important hospitals throughout many of our gateway cities throughout the Commonwealth. Critical hospitals and healthcare workers deliver care every single day. So thank you for all your work to date, and I know the work will continue because we're all in this together. I know that all of us here today, and many who are not here, and some who are gathered in the audience, are ready to work together in collaboration to navigate all the challenges before us because, like I said, we're all in this together. The Governor, the Attorney General, the state legislative leadership, the Mass Nurse Association, 1199 SCIU, and the entire healthcare community are unified in our goals, and those seem to me to be three: to protect access to community healthcare services throughout the Commonwealth, to protect vital healthcare jobs throughout the Commonwealth, and to support the communities and residents these hospitals have served for generations, some over 100 years. During these challenging times, the healthcare workers of 1199 SCIU, as you heard earlier, along with the doctors, the RNs, and the local hospital management, continue to provide quality healthcare services throughout the Commonwealth. We remain committed to protecting care in our communities, and we stand prepared to work with all stakeholders to ensure a successful transition of these hospitals to new ownership to maintain their important role they play in our healthcare delivery system. So thank you for your time and attention to this important issue, and thank you for all the leaders that are gathered here with us today, unified in those three priorities to protect care, protect jobs, and support these communities during these challenging times. Thank you very much.
Thanks, Tim. Thank you, everyone. We're happy to open it up for questions.
I know that you mentioned this was sort of a middle of the night filing. When did you find out about this?
Shortly after 3:30, they filed in Texas, and we were alerted to that shortly after 3:30.
And how do you, what happens to these hospitals moving forward? I think everyone wants to know what's going to happen with these hospitals and the way this rent system has, where the hospitals have to pay rent to these landowners. How are you going to convince other systems to take these over?
Well, I think we need to take this a step at a time. We're here today, and I think it's significant that you have such unity up here on the stage, reflecting all aspects of the system. Our workforce, those from the administration in charge of administering health and healthcare around the state, our Attorney General's office, our hospital association, our community health centers, and this is going to be about Massachusetts teamwork. What it looks like today will look different on the other side of this. That's what bankruptcy is for, though. We've got a situation where, this is a failed management team and a failed institution that has just incurred a boatload of debt. And that will work itself through the bankruptcy process. In the meantime, what will not change is that these hospitals will remain open. Patients should continue to access them for care. And we will be looking to work to further the Massachusetts interests, which have always been about protecting patients, protecting the stability of our healthcare market here in Massachusetts, and protecting our workforce.
Governor Healey, you say you're sending representatives down to the bankruptcy court in Texas. How much influence do you think Massachusetts can have over this reorganization? I mean, I think their top priority is about dealing with creditors. I'm just kind of curious, do you expect to have some sort of formal role in the actual, or say in the actual reorganization of Steward's business?
Well, there are a couple things going on at once. One is just the administration of health care right here in Massachusetts and how we're managing that, how we're working through that in terms of workforce and personnel, in terms of management of these facilities, and in terms of ensuring continuity of care. So that is going to continue. When it comes to the court proceeding, we will be making the appropriate filings, and we will be advocating as strongly and as aggressively as possible for Massachusetts interests. And those interests are patients, jobs, and the stability of the healthcare market.
You also say you want Steward out of Massachusetts. I mean, is that part of your advocacy when you're in the...
Well, that's something I've long advocated for based on the greed and really despicable conduct of their CEO and their management team in Dallas. That said, this bankruptcy filing today represents a step towards that orderly transition of Steward out of the Massachusetts healthcare market.
Governor, are you concerned? Everyone has said, keep on going to Steward, keep on going to your providers, but how concerned are you? If I'm a patient, I hear that, I'm going to freak out and say, well, I'm going to try to go to that Mass General Brigham or go someplace else. How concerned are you that patients are going to go to the other hospitals that are already overburdened?
Well, this is why my message is to people to go to these hospitals. And if you don't take it from me, you can take it from a real doctor who's going to speak to you, because we take this very seriously. We take people's safety and their ability to access quality, safe health care in this state very seriously. And it's why we've had monitors on site for weeks now through our Department of Public Health. But we want to strongly encourage people to continue to seek help at these facilities. Commissioner Goldstein, would you like to add anything, or Secretary Walsh, to that?
I will just reiterate what you said, which is that we've had monitors for over 4 months now in each of the facilities across the state, and they report daily on the conditions of the hospital, the staffing, the supplies, the policies, the procedures that are in place. We're in constant communication with all of the local hospital leadership. We want people to hear from the Department of Public Health, it is safe to get care in Steward facilities. The facilities are open. You should not drive past it if you're having chest pain, if you're a pregnant person about to deliver. Please go to the hospital that's closest to you. Go to the hospital that's in your community.
Governor, you said that disruptions and inconveniences could potentially happen here. Is there any specifics that you're watching for, or something that patients should be aware of that could happen over the next few months?
I'll let the team speak to this, but I just want to acknowledge the reality to everyone. When you wake up to news that this major hospital system in Massachusetts has filed bankruptcy, that can cause a lot of alarm and concern among residents. But I wanted to be here today with our team to tell people that we have been preparing for this. We have taken steps with partners to prepare for this, that hospitals remain open, that patients should continue to seek care. In terms of inconveniences and disruptions, that's always a possibility, and my commitment and our administration's commitment to the public is to working through all of that in the weeks and the months ahead. Is there anything?
Any specifics that you guys are watching for at all?
I want to recognize the leadership of the insurer community. That's also been a big part of our partnership. Blue Cross is here, Mass Association of Health Plans, and I think that people worry about how they're going to pay for health care, and I think that's part of the commitment we've made in the state with universal coverage. So I think we're trying to make sure that everything that is great about Massachusetts healthcare continues through this period of uncertainty, and that we use this challenge as an opportunity to stabilize the system in Eastern Mass. Steward's challenges are unique and pretty gargantuan right now, but they're not the only health system that we're worried about and trying to support. So we see opportunity here in partnership with the insurers, in partnership with health centers, in partnership with other hospitals. There'll be more to come, but I think the other thing that bankruptcy gives us is much more transparency on what will happen next, as opposed to kind of having only one side of that story. I think that the lawyers would echo that. So we're looking forward to, there's things we don't know, but we'll learn quickly, and we'll share that with the public as soon as we know.
Secretary, last question. Share what things you are looking to learn and what you don't know.
I think we've referenced this several times, but making sure that there's adequate staff to care for patients, doctors, nurses, people who work in central supply, people who work at front desk, people who pass trays, people who answer the phone in clinic. There's a lot of vacancies in this job market right now. Secretary Jones is with us today, and we want to make sure that people continue, people will do what's right for their family. And right now, if you're working at a Steward hospital, thank you, thank you, thank you. And if that needs to change, we'll talk to people. But right now, this is right. The most important thing is making sure that the healthcare workforce in our state, across our state, is supported.
Governor, quick question. You said you found out this morning. Dr. Goldstein found out last night. I was trying to get clarity on when you found out.
Well, he's a doctor. It's just a definition of morning or night. I mean, what's 3:30 a.m. to you?
Well, I think people want to know when you found out. So
No, 3:30.
4 a.m. I
Shortly,
think,
yeah, probably. They filed, they pushed the
got a heads
button
up,
on electronic filing in the Texas Federal District Court this morning at 3:30.
Was there any surprising from anyone about the timing? Sounds like you knew this day was ultimately coming. Any surprising there?
We didn't know exactly when it was coming. It was something that we certainly had prepared for as a scenario that was increasingly likely.
Governor, one quick question. Steward's officially blaming the delay in the deal with Optum for the bankruptcy, and the HBC says that it doesn't have the materials it needs to review that transaction. What's your reaction to that?
You know, one of the good things about bankruptcy is that Steward and its CEO and its management team will no longer be able to lie. And transparency is really important here, and that's why, you know, we look forward to seeing what is in the various documents that will be before the court, because we need transparency, we need clarity about debts and liabilities as we assess opportunities and restructuring as we go forward. Again, our focus is going to be on protecting patients, protecting jobs, protecting the stability of the workforce. And I want to, again, encourage patients to continue to seek care, go for those scheduled procedures. When I was speaking of inconvenience, people might wake up this morning and be inconvenienced by that and wondering, do I need to call and rebook somewhere else? The answer to that is no. People should continue to seek their care, to go to those appointments, and if you're experiencing any emergent situation, you should absolutely go to a Steward hospital. So again, I want to thank the public for their patience in this time and their understanding too in this time of what's happening. Know that we will be as transparent and communicative with all information as we can possibly be. And again, thank you to the healthcare workforce, to nurses, to physicians, to all the staff who make these facilities go. People are counting on you. Families are counting on you. You've been there. You've been showing up. You've been doing the work under challenging circumstances. We thank you so much for continuing to show up, and we will do all that we can to support this incredibly important workforce. Thank you, everybody.